health issue, and it is not talked about enough. And then just in your experience having conversations with all these leaders, healthcare leaders, and even government leaders in these countries, specifically Sub-Saharan Africa, I'm focusing on that selfishly because I'm from there. But what are some of the challenges that they face when it comes to implementing some of the strategies to eliminate cancer?
Yeah, I think one of them is definitely number one, the Lancet Oncology Commission for Sub-Saharan Africa that I chaired. We found out a couple of examples that I can point out. Number one is just awareness, and that's what's so powerful, what you are doing, through your project here, being able to just communicate, about cancer, educate people, the community about it, create awareness about it. It's just such a powerful place to start. For the 2,000 languages in Africa, very few even have a word for cancer. That's what we found out in this review of what's going on in Sub-Saharan Africa. And so even being able to just communicate this, whether it's in Swahili or in the language that the people can understand, or being able to create this content that you're creating and then translating that, so people can get educated. That's a great place to start, right? And so that's a barrier. Language is a barrier. Other barriers are really just the workforce we talked about. We see that, we need to really build an oncology workforce across Africa. Number three is just the, even when you've done all these things, the cancer care cost, so that's why we advocated for universal health coverage, for these countries. The countries should include cancer in their national cancer, universal health coverage in their countries, insurance. And then number four, you can think about, just being able to have the infrastructure there. Nowadays, we have telehealth and technology, and I think that's one area where, can really be a place where Africa can leapfrog, really, because if you invest in these technologies, you can just take pictures of cervical cancer slides, telepathology, and, you can help even with the multidisciplinary teams looking at that slide and giving the diagnosis. So you no longer have to have the physical location. You can use technology. So the infrastructure is a big issue, but cervical cancer screening actually, the cost of it is not, the biggest problem. You also have the issue of cultural barriers that we talked about. I know you have had a conversation with me about, even just women not being, you have to really respect women, and then their role also, in the culture with their husbands. Sometimes they need permission from their husbands to even get screened, those things. And it's very predominant in some cultures. And so you need to overcome those barriers.